When the customer's not happy, the insurance company responds. When the dental office isn't happy, they don't care, because it doesn't have anything to do if they pay or they don't pay. They're not connected to the dental office in the same way they are with the customer. So that's the difference. And so when you, as the customer, become involved, we have seen insurance companies who have denied care that we have submitted, and the patient has then taken it on, called the company, complained, talked about their policies, talked about their companies, etc., and all of a sudden they're paying it. So it is something that, if you, as the patient, want the insurance companies to cover it, especially if there's a pre-authorization, and then they come back to deny it, well, at that point, I'm done, because I've done everything I can do through my office people to get the insurance company to commit to whatever they're supposed to do. And beyond that, there is nothing there that means that if I continue to submit, they're going to change their minds. They won't. So I can submit the same thing over and over and make new justifications. It doesn't really matter. Consequently, under the agreements that offices have with patients, you're billed. Your responsibility is to cover the cost of care of anything the insurance company doesn't cover. But what I'm saying is, if you then complain to that insurance company that this isn't fair, and you had been led to believe something else was going to occur, they can respond to you and will make adjustments. And let's be honest, they don't get that much from patients. They don't get complaints. They're interacting mostly with offices. That's where their communications go back and forth. For a customer to call up and complain is rare, and consequently they won't respond to that. If they responded to me, for example, maybe what it would be is a bigger policy change, and they'd have to do whatever they're doing for you through me, to other patients through other offices. So it may be a bigger policy change according to them, or in their thinking, than it would be if an individual complains. Maybe they'll just pay that person off, and then they'll keep everything as it is and keep moving on, and they'll just take it as a little adjustment that doesn't matter a lot, because it's not impacting a lot of other people. The point is, your clout is huge, and you should know that. But most patients, they don't know what their insurance covers. They don't know anything. You're well advised to just read the booklet, which is on the line, and it's probably just a few pages long. It isn't that complicated. So, is there anything else we need to talk about with regards to this? We talked about how insurance came about, how it's a third party. Now it's entrenched into life. It has affected how patients and providers, healthcare providers, interact. The worst thing I could see being done would be to federalize everything, make all of this go away, even the private insurance, make it all go away and put it into one umbrella under a federal government. That would be a big mistake. Now, one argument that I can address: you're from the military, Ben. You worked under a system that covered the costs of the patients. Yeah, I was on a salary, and it didn't matter what the patient got. They could get anything that the government decided to provide for them, they could have. Now, I will tell you that there are things that are limited even within that government system in the military, but it was really good care, and the quality of the medical care is extraordinarily good. And why is that? And the answer is because we're not there for the medical reasons. We're not there for patient care. We're there as a part of the defense of the country. In other words, the reason that there's medical and dental within a military operation is to keep the fighting troops healthy so that they can fight for the country. So the money that's allocated to the medical and dental systems within the military are kind of, they're collected by taxes, but they are sort of a write-off to the cost of defense. So you can say, well, look at the quality of the military. That's extraordinary what they're going to do. So if we can get what they have if we open up all medical care and have it under the government. And the answer is wrong. It won't happen. What you're going to find is that everything gets harder to get, and you're going to find yourself in a lot of lines. The other thing is, if you ever go on a military base and you walk into offices, they're pretty austere. There are a lot of regulations as to what you can put on a wall, and everything has to be framed, and they're all controlled from entities outside of even that facility. In other words, some general is dictating what the color of the paint, and I've lived through that, where different buildings were repainted because a new general came on and didn't like the color, and so it was changed from one drab color to another drab color. But it isn't that people have a lot of liberty and freedom to do things with regards to walls and all the rest. You can't decorate it because it's a federal government facility, and so go down to the IRS office, or go to motor vehicle. Go to motor vehicle and look around. It's a government entity. It's maybe state run, but it's the same idea. People are not owning that building; they're working in it. No one takes that kind of responsibility. So the level of the cleanliness and all of that is by rules, and it has more to do with policies that people can check and do checklists on than it is personal tastes. Now walk into a dental office owned by someone, and you'll see that it's nicely decorated and clean and friendly, and actually has plants perhaps that are living. There are things, or aquariums with fish that are swimming in them. That's a very different environment because people are taking personal ownership of their environments because that's the kind of work they want to do, and they've chosen to go into the private sector as opposed to the public sector. So if you really like the decor of the motor vehicle department, then you're going to want to have general health care that doesn't really care a lot. One of the arguments, too, I want to just say, is that the United States doesn't cover people the way other countries do with regards to health care. And that's not true, because we have emergency rooms, and people are going in and having care even through emergency rooms. No one is dying on the streets in the United States unless they've placed themselves there and have either been murdered or died from alcohol or drug abuse or something. But the point being that if you're poor but you're trying your best to survive, you can walk into an emergency room with a heart attack or chest pain, and they're not going to turn you away. They're going to do what they can, even though they may never get a dime out of treatment. They're going to do it. So the idea that isn't happening is not true. The United States is a very compassionate country, and we do take care of people who can't take care of themselves. So I think that's it. I'll stop now. Next time we'll just talk about something else. We're done with the dental insurance part for a while. Unless you have questions or comments, let me know. And have a good one.